Thank you for joining us, every participant, on this 9th series of COVID pandemic webinar series that is organized by the Center for Human Rights. We've been privileged to listen to 8 other series seeking to examine the impacts, socio-economic and political impacts of this pandemic and the human rights implications, the actual and potential human rights implications, with some particular recommendations on how to deal with these human rights implications. Today, we are joined by an esteemed panel of 3, and one person may join us in the process to talk and gauge the impact of international human rights organizations and the work they do in the context of this pandemic. This series is presented and hosted by the Center for Human Rights, but mostly has involved the participation of us alumni. And today I'm privileged to have with me already 3 particular alumni of the program. We have Preciouseriamiatoe, who is the delegate in charge of File of Missing Persons of the International Committee for Red Cross, ICRC. We also have Dr. Adem Abebe, who's the project lead, Peace, Constitutional Building in Africa for the International Institute for Democracy and Electoral Assistance. And we have with us Monica Tabengwa, who's the program manager for HIVOS South Africa. Each speaker will have about 10 minutes to kind of give remarks on specific aspects of how human rights institutions and organizations have dealt with the pandemic. We'll have about 40 minutes at the end of their talk to kind of have a back and forth in a Q&A. And right now, you'll just see a poll which we'll have at the beginning and a final poll at the end. And so if you could just kind of choose and answer this quick and short poll. Before kind of our speakers get into their remark, I would like to introduce the topic or the theme in a few remarks. So we have a pandemic which is like none other in terms of changing our world and presenting us with a new abnormal normal, really. In that context, it's a public health pandemic that states have dealt with as a public health pandemic. At the same time, it has these socioeconomic and political implications that I think present huge challenges for human rights. In dealing with those challenges and dealing with the promise, or what the pandemic reveals to us kind of as presenting us with opportunities, we do have the ecosystem of organizations, multilateral state organizations, but also non-governmental organizations within particular countries. Today, we are privileged to have our esteemed speakers being able to present to us views and the perspectives from the ecosystem of multilateral or international organizations with broad capacity or specific capacity and working across countries. My name is Godfrey G.Odongo. I work for Wellspring Philanthropic Fund, which is a private foundation. And now we've seen 4 quick things that I wanted to say. The first is that we've seen international human rights organizations and multilateral organizations of the kind where our speakers come from, leverage their voice, conduct research and policy that surface how this pandemic impacts civil liberties and freedoms and coordinated responses across particular countries. On the second note, apart from civil liberties, we've had a lot of organizations focus on how this pandemic bring to the fore matters of inequality and violations of socioeconomic rights. And again, sought to pull together thoughts, convenings, and policy discourses around inequality and socioeconomic rights. Thirdly, we've had the fact that the pandemic is impacting people within borders, but we need to coordinate, and there's need for international coordination. And fourth and last, as I've kind of hinted, the pandemic has brought to the fore the need to think of a new world, and in
Good morning. It seems like Godfrey, can you hear me? We have seemed to have lost you.
I can hear you.
Oh, great. Okay, sorry, we have just lost you for a bit there. Please continue.
Okay, so I'm inviting Precious to just give us insights on the impact of that the international human rights organizations, particularly the ICRC, has had in its specific mandate during the COVID pandemic. Precious, you just have about 10 minutes before we turn to Adem. I think you're muted, Precious.
Can you hear me now?
Yes. Yes,
Good.
we can hear you.
Yeah, so good morning again, everyone. My name is Precious. I'm happy to be part of this discussion to talk about the impact of international human rights organizations during the COVID pandemic. And I'll be speaking specifically on the impact of international human rights organization. And what I would like to do, and first of all, disclaimer, I'm not speaking on behalf of the ICRC, but rather speaking based on my experience and the trends I've observed and general information in terms of the activities that have been done, rather than voicing a position of the ICRC per se. In that light, I would like to maybe piggyback on what you have said at the introduction to really situate human rights within the context of the COVID pandemic, and then narrow down to specific aspects, especially within the humanitarian setting of how there has been impact in different thematic areas. I would like to look at the healthcare sector. I would like to look at protection of family links, management of the dead, as well as in detention. So by way of introduction, like you rightly said, human rights, the human rights issue is very central to COVID, and there's been lots of discussions around that. Especially even at the UN security level, discussions around the need to adopt a human rights-based approach to the response, to the COVID response, and the fact that certain rights have seriously been impacted. And Godfrey, you already started mentioning some of those rights, and I would also add other rights such as the right to education, for example, the protection from sexual violence. Apart from that, when we think about the people who are affected by COVID-19, the populations affected as well as the populations which these international human rights organizations serve, some have been more impacted than the others. I think about populations in conflict settings or in communities affected by violence, populations on the move, and other vulnerable groups. So I think we should also bear this in mind when we think about the impact. That being said, another thing to note is that the COVID pandemic is quickly evolving. And what that has meant for many international organizations and even local organizations is that they've had to adapt and evolve new ways of working. This has brought about limitations in terms of the extent to which they can reach affected populations, the manner in which they can reach affected populations, and the manner in which they carry out their work. International organizations work across countries. Travel restrictions, lockdown measures have meant restrictions in traveling to the field to reach the affected populations, to carry out field visit, monitoring, evaluation, and all of that. So that also has to be put in context. But it's also that it's also reduced face-to-face interactions and the need to devise technology and new means of communication. But bear in mind that the most underserved communities are usually those that lack this infrastructure. So this also places a limit to the extent to which international organizations can reach affected populations. And I think this is something that we should also bear in mind when we think about the impact. But it's also that some organizations have actually not really been affected per se, in the sense that they already had normal working methodologies that allow them to work remotely, or that really doesn't involve a lot of physical interaction with populations that are affected. So this is also something I think we should bear in mind. That being said, and having regard to the fact that international organizations have had to adapt their working methodology, how have they been able to do so with the view of really bringing about change and supporting and helping people whose rights may be threatened? And I would like to just focus on some specific topics which I have highlighted above. And in concluding, I would like to wrap up with the need to sustain the dialogue and the engagement, and what COVID-19 has taught us about the broad issue of human rights and governance going forward. Generally speaking, before narrowing into the specific, I would like to say that a lot of international organizations have done well in terms of raising awareness, advocacy, dissemination, key messages on prevention, trainings and all of that. So this, I think, is something that we can all easily associate ourselves with, whether raising awareness on the spike of sexual and gender-based violence, the need for access to healthcare, and all of that. So I think at general level, we can say this is something that is ongoing. At a more specific level, I'd like to highlight some areas that really come under pressure that have come under pressure with during the COVID pandemic. The first, I would say, is the protection of family links. Of course, travel restrictions, lockdown measures have led to lots of family separations. And think about this in already volatile settings where there's conflict and violence and where people are fleeing or on the move. This also further, exacerbates their situation. And I think one thing that has been done there is helping families to maintain contact by facilitating phone calls, the exchange of family news to ensure that families stay in touch and maintain family links. And I think this is also something that is significant. The other I would also like to highlight is in the context of detention. And when we think about the COVID-19 response and how it has taken a lot of African governments by surprise, it is also not surprising that those who are deprived of their liberty are not necessarily those who are on the priority list in terms of the response, prevention and response to COVID. And I think one area in which we have seen impact is the support to detaining facilities in terms of providing them with relief materials, hygiene and sanitation materials, training, but even going as far as providing them with facilities that could help in the actual response to COVID-19, such as isolation centers and bed. Of course, that with the situation of detention in many countries in Africa, with overcrowding, a lack of human and financial resources, and poor hygiene and sanitation item, the prisons are very, very vulnerable to the spread of COVID, and it could spread really quickly, coupled with the fact that there's not good access to healthcare. So I think this is one significant area in which the work of human rights humanitarian organizations, generally speaking, can be felt, including training on prevention, the use of PPEs, donating PPEs as well is one area I think is worth highlighting. On top of that is the fact that, as we know, that COVID-19 has also brought a lot of challenges in the way government institutions work, including the judicial process. And the question to ask is that how have detainees, inmates, have they managed in terms of access to justice? We already see that some courts have adapted to online court processes, teleconferencing and all of that, but it's still to be seen how effective this has been. I just also want to flag this, generally speaking, when we talk about the human rights movement in general. And I think this is something that we can think about further later, is that how has this impacted access to justice for those who have been deprived of their freedom? Another point I would like to highlight, which is not necessarily a very popular one, is the impact of human rights, humanitarian organizations in relation to the management, the safe, dignified management of the dead from COVID, as well as mass mortality planning. We all have seen how COVID has led to a rise in casualties, high numbers of casualties. And a lot of governments have been overburdened in terms of managing the dead. But we also know that in many countries, especially in Africa, there's not so much of mass fatality or contingency planning. And contingency planning is not when there is a crisis, it happens before a crisis. But the question is, how many governments are crisis ready, emergency preparedness and response? So this is one area in which international organizations have been able to provide expertise and capacity building in terms of training, in terms of providing materials, personal protective equipment, training frontline workers on how to properly manage the dead, to ensure respect and dignity for the dead and their families, but also to protect frontline workers from being affected by the virus. So I think this is also one area in terms of when we think about the gaps that international organizations have played a role or have had an impact, the dignified and proper management of the dead. Another area I would also like to highlight as I try to wrap up is the issue of food, water, and other essential items. And we've seen that there's been a lot of support in this regard, either through cash assistance, especially because it becomes extremely difficult to carry out donation activities because of social distancing rules and the restrictions on mass gatherings. So being able to support families whose livelihoods have been affected. A lot of people have lost their jobs. A lot of people can no longer work because they fell sick from COVID, and helping them to be able to maintain their food supply, not only in quantity, but also in quality. And that also goes to other essential, ensuring that other essential services such as water supply, which is extremely relevant in the context of COVID, given that hygiene is intricately linked to the prevention of COVID, and making sure that vulnerable communities can continue to have access to such essential life-saving services. And just in closing, I just also wanted to piggyback on the first point I made in terms of human rights and COVID, and how COVID has really, I would say, revealed or taken off the lead about some of the very pressing and underlying human rights and governance issues in our society. Like I said, a lot of international organizations have done a lot of awareness raising, advocacy, dissemination, and I think this really creates an opportunity for us to sustain the dialogue. I really commend what the center is doing in hosting all of these webinars to engage different sectors, different audiences, different speakers. I think this is something that really should be encouraged. But it's also that COVID has exposed some of the things we've been talking about for a very long time, like poor access to healthcare. And the irony of it that the leaders can no longer run away from it. It's now the authorities, it's now an issue that is very close to them, because they are also directly and closely impacted by it, and seeing how the decay in the health sector can significantly affect countries all over Africa. So I think and not just that, COVID has also revealed deep issues around poverty, but also around the trust that citizens have in the government. In Nigeria, for example, we've had issues around people saying that there is no COVID-19 in Nigeria. They do not believe. What does that expose? It exposes the kind of social contract between the government and the citizens, and whether they do trust the government, whether they believe the government. It also exposes deep-seated issues of poverty and how people could, defy lockdown orders because they believe that hunger is going to kill them faster than the virus. They would rather have food on their table and take the risk rather than, stay home and then, not die from hunger and all whatnot. So I think these are some of the things that we are already doing, and I think we should sustain. I really want to flag what the Justicia, which is a Colombian-based human rights organization, the initiative they've done in this regard, one of the things they do is to bring, to foster South-South collaborations through research, writing and advocacy. And they've recently launched an initiative as part of adapting to the COVID-19 pandemic to allow young human rights researchers and writers from the Global South to relate their experiences. So they are collecting experiences and stories, personal and professional experiences of how COVID-19 has impacted them and their communities, and being able to make this available to the wider public. I think this is the beginning of a significant dialogue that should continue even post-COVID. And just to conclude, I would like to say that, and just as the chair of the panel highlighted, human rights has come to stay. It's really central to the COVID response, and we can no longer shy away from this. They need to adapt a human rights-based approach. They need to focus on human rights and different aspects that are affected. But I think that as we continue to evolve and learn and adapt new working methodologies, one thing is central, is that the protection and the respect of the rights of the people and the communities that we serve must always be at the forefront. Thank you very much.
Well spoken. Thank you, Precious. Speaking of social contracts, Adem, would you want to tell us about some of the emerging issues on constitutional design and constitutional building, or perspectives on the social contract? Adem, you have your 10 minutes.
Thank you very much, George. Now, just before I start, I think it's important to say that I was asked to speak mainly on constitutional building rather than directly on human rights issues. Now, obviously, constitutions deal with the way institutions are designed and redesigned, and that has systematic implications to human rights. And in some cases, human rights are actually direct subject of constitutional reforms. That's the first point. And the second point was to speak also about how international organizations, especially in the African context, the African Union and sub-regional organizations, are responding to constitution building issues. And again, often constitution building is seen as a sovereign, locally owned exercise. So there is an understanding that internationals should support it, merely support it, but it's owned by the domestic political actors. Now, having made these 2 points, as most of you know, increasingly conflicts have become internal. Conflicts occur within states. We still have interstate conflicts, but the major challenge today is domestic conflicts. And a key, a relevant part of resolving domestic conflicts is the constitution, how you design the constitution. That's why in post-apartheid South Africa, or post-2007 conflict in Kenya, or even after the civil war in Cote d'Ivoire, you see that the new constitution is what comes first whenever there's a transition. So there is a constant movement as we have political contestations in every country, whether in Africa, but also globally. There is always a constitutional reform process occurring. And one of the main impacts of COVID-19 is actually to disrupt that, just like it disrupted elections and other things. So if you look at, for instance, Botswana, they were expected to start an entirely new constitution making process. Sudan and South Sudan also in a transition, they were expected to start an entire constitution making process. And also more recently, Guinea-Bissau. And what COVID has done essentially has shelved most of these processes. At the same time, it has also given some advantage, some impetus to some reform initiatives. Perhaps some of you may be following what's happening in Algeria. There was a big popular movement, and part of the demand was for a new constitution, but the new government essentially took advantage of the COVID crisis to drive a constitution that the people would certainly have opposed in the streets, but they are not doing because of COVID. So the COVID circumstance have actually given opportunities, advantages to some callous governments to push forward reforms that would otherwise have been resisted. And perhaps a very good example is what happened in Guinea-Conakry, Some of you may know that Guinea-Conakry had a referendum at the end of March, one of the countries that actually went with an election just before the crisis became worse. And they had an election and a constitutional referendum. And the constitutional referendum particularly was designed to bypass a constitutional provision that expressly prohibited the incumbent Alpha Condé from running again. And quite interestingly, the constitution actually also prohibited the amendment of that provision. So what Condé and his supporters did is then work around this prohibition and work towards a new constitution. Essentially saying, okay, we cannot amend the constitution, but we can have a new constitution. And the African Union and ECOWAS, unfortunately, because of the understanding that constitutions are, they are a domestic exercise, a domestic sovereign exercise, they were very reluctant to intervene. They were very soft. In the end, they refused to send, for instance, observers to Guinea, which was in a way to show they disapprove it, but they didn't do much. And the failure to send observers could also have been connected with concerns regarding COVID. But I think that the fact that the Guinea and Algeria have used the opportunity to push forward reforms that essentially undermine the constitutional framework is critical. Now, COVID has also given rise to its own new ideas, new changes. And a good example is perhaps what's going on in the Central African Republic, partly because the Central African Republic has a constitution that was designed from an experience of abusive incumbents, abusive presidents. Just like in Guinea, what the drafters of the constitution did was prohibit the amendment of term limits, but also the extension of the duration of each term in any circumstance. Now, basically, there is no option under the constitution to extend the duration of the term of an incumbent. And now what COVID has done now is it has made preparations for elections essentially very difficult, if not impossible. So now they are supposed to have presidential elections in December and legislative elections in March next year. But the presidential elections are in December this year. And now, because of COVID, preparations have not started yet. You cannot register voters. You cannot educate voters. Political parties have to campaign, build their constituencies. Quite simply, elections are not a single day event. It's a cycle. It's a long-term process. And there is concern that because they cannot hold preparations, it will be very difficult to have free and fair elections in December. And now you have a constitution that is very clear, that gives no opening essentially to adapting to a level of flexibility to adapt to circumstances like this. But obviously they did not think about an event that would make this impossible. So what the government did essentially was, rather than trying to amend the provision that puts two-term limits, it sought an exception, a force majeure exception, where the period of elections can be pushed. So the term would be 2, it won't be extended, but the duration could be extended. But as part of the constitutional amendment process, these proposals have to reach the Constitutional Court. And the Constitutional Court quite understandably said, sorry, the Constitution cannot be changed. But at the same time, and this is where it becomes fascinating, at the same time, the court recognized the necessity of the circumstances. It recognized that we cannot change the constitution, but postponement might be necessary. It might not be avoidable. So what it did is essentially, it said, okay, we have a constitution that is an outcome of a national consensus. And if we can have that, if we can have a consultation process where the government, the opposition, civil society organizations can sit together and carve out an exception of sorts based on agreement rather than through constitutional amendment, then the court could approve it. Now the court will still have to consider that there has to be a consultation, and then there has to be an agreement, and it has to go to the Constitutional Court to approve it. Now it's a very interesting role for a constitutional court, but the necessity. The necessity of the circumstance might have called that. So it's something very interesting to follow, especially because, as I said, even if in December COVID has been controlled, preparations would have been incomplete. So postponement might still be necessary. So we might still have to see how this fascinating proposal might move on. And perhaps to conclude, I see I only have a minute. COVID is already having significant economic impact. There's a huge economic distress. As you may have read, a lot of African countries are already under huge debt burden, and this is going to make things worse. You are not raising money, but you need to spend more, which means we have to spend more. So there's going to be a significant economic impact, but also in terms of our psychology, in terms of our way of life. COVID is going to have significant economic, social, cultural, psychological consequences. And all of this might actually lead to political upheavals. A lot of African countries already have vulnerabilities, fault lines, structural often, and COVID might make it worse. And all of this may lead to political upheavals. And as I said in the beginning, whenever there is political upheavals, whenever there's political contestation, a significant part of the reform package to get the country back into the right direction is constitutional reform. So the African Union, ECOWAS, but also organizations, international organizations, have to have this in mind, that there may be more constitution building happening afterwards, and be ready for it. And I think I'll conclude with that, and I'll be very happy to take any questions later. And thank you very much again.
Thank you very much, Adem. I've seen a couple of comments in the chat that seek to ask what are we discussing and what is each speaker discussing. For those who joined us late, we are talking today in this 9th series about gauging the impact of international human rights organizations in light of the COVID pandemic. And we're exploring different issues. Adem has just spoken about the constitutional implications of COVID, and Precious, if you joined just now, spoke to thematic and particular aspects that interact with the work of different international human rights organizations. Let us switch gears to Monica Tabengwa, who will talk to us from the lens of policy analysis, human rights research, and some of the issues that we are encountering there from the perspective of an organization that is based in the Southern Africa region. Monica.
Thank you, Godfrey, and thanks everyone for attending. As introduced, I'm with HIVOS. I'm the program manager for the LGBT in Africa inclusion, LGBT inclusion in Africa, and that's LGBT is lesbians, gays, bisexual, transgender persons, the inclusion into the human rights framework of Africa. And I'm based in Harare, but I'm originally from Botswana. So I'm going to speak a little bit about what has been introduced by Godfrey around the need for information, the right kind of information, the right kind of data, research, and why it is important. And I feel that it is necessary, it will be necessary for me to kind of go over a little bit of what, especially what the first speaker talked about in relation to COVID-19, obvious facts that we know, and just to really elaborate why data and research is important and policy analysis is important at this time. So we do know that COVID is present, and it's going to be present for a long time. It's causing a lot of damage and reversing a lot of gains that we've made in the last decade or so in all of the 55 or 56 African countries. And we also know that it's still early days yet, and basically what that means is the cycle of the pandemic has not been felt fully yet. There has been predictions by World Health Organization and other experts of bigger impacts, higher mortality rates and so on and so forth. But what we have seen in Africa is low numbers, and that trajectory has been constant now for at least 2 to 3 months, which kind of gives us hope in light of all the dire predictions that we have seen. Of course, there are still problems with that, because that could be attributable to low testing and reporting. But relatively, we know that the numbers are low in Africa. South Africa is an exception, but generally across the board. We also know that each country is affected very uniquely, very specifically, depending on various variables, depending on the various strengths and vulnerabilities in each country. I think Adem spoke about governance, issues around rule of law. Those are some of the variables. The strength of structures or infrastructure, the health system, etc., etc. And those are very, very important in how things, our reaction or how we transition through the pandemic and across. And so a lot of this depends on governments and what they do or what they have done and what they do in the future. What we have seen with governments is quarantines, lockdowns, border closures, limitations on movement, etc., etc. What we also know is that Africa, even though possessing most of the resources, has challenges, big challenges. We know that we were not going to be able to meet the SDGs, the 2030 dates or the 2030 mandates. We know our healthcare systems are challenged. There continues to be human rights violations, issues of governance, accountability, just to say by a few. Limitation of resources. That's something that we are debt-ridden as Africa, and just managing knowledge or being able to create knowledge to manage crisis is another challenge that we have. So these are some of the things that we know, and the reaction so far has been really quick, and if in some cases efficient, but quick in the sense that the lockdowns happened very quickly, and they may have led to this kind of curbing the spread very quickly to maintain these low numbers. But what we need to understand now is even that has had some impact on different people. Disaster unfortunately affects people in different ways, and many of the already marginalized people are impacted even more so. And so we have seen a lot of issues coming up, the indirect effects of the COVID-19, and we have food insecurity, loss of income, livelihoods, the recession in economies, access to public services, health, etc., etc., are issues that are, that have affected us. And so at this point, I think we've had enough time in some ways, as we see now the loosening of the lockdowns and the restrictions. It's now, I think it's time to kind of, sit back and think about how to actually survive this and thrive after the pandemic. And a lot has to do with exactly what I said, how the government reacts, but also about the people. I think those are the most important part of surviving any crisis is our communities. What about them, and how can they be involved in the transition, in survival, in developing the solutions, and what do we need to be able to give them the tools to be able to survive, and what can we learn also from what has transpired before, because pandemics, crisis, this is not the first one and it's not the last one. We've survived worse. We've survived HIV, we've survived Ebola, we've survived internal conflicts. How have we survived that? How has our communities been able to participate and contribute in a meaningful way to carve out solutions, to ensure that their people remain standing and the casualties are limited, and just really to promote well-being amongst people. And in that sense, it brings me to civil society and how important it is to have civil society in every given community, and a civil society that is strong, that is able to serve its people and represent. And civil society depends a lot on information. And so for me, I think it is important that at this stage, we should acknowledge all of this stuff that I have mentioned and start thinking about analyzing this information, disaggregating it, finding out who are the most impacted people and how can we include them in the strategies going forward. In this sense, I think one of the speaker before me mentioned women, youth, and other marginalized communities. We know that women bear the brunt or the heavy lifting in any crisis or in life in general. And they have the least resources to do this. And that means they are impacted even more today. The food insecurity, the access to health, the resources impacts them even more, even as they bear the duty of care, the burden of care of our children, of our aged, of our ill. And so what can we do to ensure that these inequalities that have been existing are not exacerbated? And so I think it is important that analysis, research should be undertaken to find the specific, not only the root causes of inequality, but specifically how it affects women, how it affects these people living with disabilities, how it affects LGBTI people, how it affects other minorities, to be able to tailor-make solutions and interventions. And we know that civil society has been doing a lot of the heavy lifting and a lot of the work, you know, reaching out to communities, giving out, you know, supporting people, giving material help, taking care of mental well-being generally across the board. And so it is important right now to understand that there is no future without a strong civil society. And so that means resources. We need our governments to be, you know, to recognize, first of all, the work that NGOs do, the work that civil society does, and form very impactful collaborations and community, a sense of community. And I think there's always been you know, power relations, because there's money is in the hands of some people and not in others. I think in times of pandemics, you realize that there's a need to shift because naturally people don't trust government for good reason, and they tend to trust civil society organizations because, one, they live among them. They know their needs. They are constantly researching. They are constantly in contact and interacting with ordinary people. And so there is a level of trust between communities and their leaders and civil society. And so there is need to actually involve all of these people, making sure that we, you know, the shift in power, the shift in participation, the shift in implementation is put in the hands of people who are on the ground. And we can learn from, the documentation that has been done before, from Ebola, from HIV, and those are important lessons to learn. And I think we need to continue documenting all those good practices, all those practices, to be able to use them going forward. The other thing, I think, as much as it's important to react to the immediate impact, I think we've come to realize, as I said before, that there are challenges. We know the challenges, and we know that we were not going to be able to meet the target. So this is an opportunity, actually, to rethink and reanalyze, our process.
You young man. Oh.
Hello, Monica. Did we lose you?
Yeah. Did you lose me?
No. Go ahead. I think we had an interruption. Go ahead, and we have like just about a minute. Just wrap up in a minute or two, as well.
Okay. Yeah. So I was just basically concluding to say, just the need to look at this as an opportunity to change our mindset and think about a different way of achieving the SDGs. For example, when we say leave no one behind and do no harm, we should be looking at the end, where we have more inclusive societies, where the bottom-up approach is what we kind of our default approach, rather than the top-bottom. So that means really listening to people on the ground and ensuring that they have the skills, they own the solutions, and they are the ones providing those solutions to their own people. And so, and I think just lastly, someone spoke about human rights in general, and I think they should be at the core of every intervention that we do. And that is also understanding, again, that there were inequalities before the pandemic happened. There will be inequalities. They are being exacerbated now by the pandemic. And so very much paying attention to those issues and making sure issues around gender-based violence, issues about sexual orientation and gender identity, minorities in general, they are, the solutions and participation especially, that they are able to tailor-make those interventions to be able to respond. And that can only be done if we have information that is disaggregated, that is very specific to what caused the human rights violation, and what are the drivers of inequalities, what are the drivers of discrimination. Thank you.
Thank you very much, Monica. You've given us a few things to chew over. I will urge the listeners to kind of just have your questions in mind. We see some questions already coming, and we hope after Anietie speaks that will revert to these questions. I have the pleasure to welcome Anietie to speak to us. She's with the Africa Human Rights Watch division, the Africa division of Human Rights Watch, and she'll be speaking to us about some of the emerging challenges for human rights defenders and activism in Africa.
Thank you so much for having me. It's a pleasure to be here and be part of this really important conversation. I think Monica's presentation was just perfect. It was a perfect segue for mine, because she spoke extensively about the need for information and how important it is at this point for us to be able to respond to the pandemic in a way that is rights respecting. And I think that for human rights defenders across the globe, we've seen really deep challenges with regards to research and advocacy, which is really the mainstay to be able to get this information and be able to drive change with the information. I think that this has been the most obvious impact on human rights defenders. That is the ability to go into the field, to get information at the source, to conduct research, to document abuses, to connect with people who have suffered violations, or just mobilize people to speak up against abuses. It is at the heart of the work that we do, and it gives a basis for us to advocate for change. Despite the lockdowns and restrictions on freedom of movement and concerns around COVID-19 transmissions, human rights defenders are still under pressure to get the work done, especially because, as other speakers have said, COVID has raised a number of critical human rights issues across the globe, including issues around the right to health, poverty and inequality, abuses by security forces, amongst a host of others. And with many people now forced to work remotely, there is a huge reliance on technology, which is good, but certainly not without its challenges. Human rights defenders are using tech not only to connect with each other like we're doing now, but to conduct research. And many of us have had to now place an emphasis on using closed society research, which was formerly employed as a measure to gather information from parts of the world that was just impossible to get access to for several reasons, including security or imposed government restrictions or constraints. It is now the same situation because of COVID everywhere. And we're thinking of ways to conduct credible research and connect with victims and witnesses, and still put out this important information that we need to be able to drive various policies or the implementation of policies in a way that it is beneficial for many of the people that we advocate for and many of the issues that we advocate for. It's come at a time where, like you said, many things are falling apart as we see it. In Nigeria, where I focus on, we've seen a lot of the human rights concern come front and center, but with constraints around movement, it's been incredibly difficult to get the work done. And even where we focused on using, strategies from closed society research, it's still been very difficult, and it places an extra burden on human rights defenders to find ways to corroborate testimonies, for example, that's gotten through telephones, and just to make sure that information is still credible. And not only have these measures become more tedious, but it's also it's really shown socioeconomic disparities, access to phones and data, and phones with encrypted apps for safe phone calls when security is a concern is not the same across board. In many of the communities where we work and where we advocate for people, these things are very difficult to come by. And so it places an extra burden on the people who have suffered human rights violations to be able to put their stories front and center. But we're also seeing more use of open source investigation to conduct research and find evidence that confirms the various issues that we're trying to advocate for. Open source intelligence pretty much consists of using everything you can obtain from publicly available sources, from Google Maps, social media, to public data sets and free online tools. Just last week, Amnesty International released an entire report on the global use of tear gas, which fuels police abuses based on research carried out through open source investigation, and found on through videos and other resources found on social media platforms. It was a really powerful report. And it verified, close to 500 videos and highlighted over 80 events across 22 countries. Really well done. While at Human Rights Watch, we continue to explore this and other innovative ways to find out more and confirm more stories and get victim stories at the front and center. And I think there is something to be said about the need for human rights defenders to not only work with community groups in terms of advocacy, but also equip and empower them to be able to document and tell their own stories in their own ways. I'm currently working with a community group in Lagos that started a web series called The Corona Diaries, which pretty much consists of audio recordings and videos that they've done by themselves to tell the stories of people who are affected by COVID in different ways, especially with regards to loss of income during the lockdowns. It's really powerful, and we are incorporating this into a report that we're doing on the impact of COVID-19 in informal settlements and on vulnerable groups in these informal settlements. However, it doesn't stop here, because researching the problem goes hand in hand with advocacy to ensure that appropriate measures are taken by the authorities to address the issues that we're highlighting. Unfortunately, mobilizing and advocating for change has also become extremely difficult with the pandemic. And critical voices and groups are being left with little or no opportunity to influence policies or reach the decision-making level. Even with some of these unprecedented measures that have been taken in a rush to respond to COVID, emergency powers that governments have adopted, they've been done without the usual democratic process for the most part. We've seen a situation where many of the laws that have been adopted give the governments unlimited powers for an indefinite time, simply because there was no space for extensive public debate and pushback from those who would usually do it: civil society groups, human rights defenders, and activists across these countries. This is essentially because there's a lack of access to proper information from the authorities. People cannot move around to get that information. And the government has wide room to be able to take on as much as they want. And with the media embroiled with, COVID-19 reporting, it's also been really difficult for human rights defenders to get their stories front and center. However, we've seen social media play a huge role in building strong and powerful campaigns that draw attention to problems within the context of COVID and outside the context of COVID. Recently in Nigeria, there was the rape and murder of a young girl, which would ordinarily have gone unnoticed, except for women's rights groups that were able to organize so quickly and impressively on social media. And this has led to a lot of positive results that we're looking forward to working to ensure we get justice from. And I think another main issue that we've seen is really threats to human rights defenders within the context of measures that the authorities have taken to curb the transmission of COVID. We've seen that digital surveillance is being employed for contact tracing, to enforce quarantines, to assess the general trends on how the virus might be spreading, or to determine the effectiveness of social distancing measures. And we've seen this in places like China, Iran, and Russia. They're using digital surveillance measures that threaten individuals' rights to privacy, to free expression, and to association. In places like Armenia and Israel, sweeping laws have been passed that threaten privacy by requiring telecommunication companies to turn over cell phone histories and location to the authorities. And this is a trend that we're quite concerned about, because it can easily spread across the globe. We're seeing countries like the UK and the US exploring ways of using cell phone location and facial recognition in the context of COVID. And where we have already oppressive governments with tools like this, it poses a lot of concerns for human rights defenders. And we've already seen some of the documentation we've done in various countries across the world that it's been an attack. There's been an attack on human rights defenders using various measures such as this. And the problem is compounded when these human rights defenders are easier targets. It's compounded because they're isolated. They're away from a lot of the support and the security measures that they can take, including leaving the country or finding a safer place to hide until the issues blow over. Even though the UN has warned that strong data governance frameworks are key to prevent governments from taking advantage of the crisis to violate human rights, we're seeing that more and more being considered and it's actually being adopted. And I think I'll just wrap up by saying that human rights organizations have a huge role to play in really shaping the way that human rights are considered in the policies and the measures that various countries, and I think various international organizations as well respond to COVID. While we're still in the process of figuring it all out and trying to find and implement measures that need to be taken in this unprecedented time to support the abilities of human rights defenders to continue working, especially when civil liberties, human rights, and fundamental freedoms are under extreme pressure on a global scale. I think that we can take up the areas of expertise that we have already achieved, especially with regards to closed society research, with regards to using technology and innovative ways, including satellite imagery, drones, or open source investigations, which we've really consolidated our knowledge and expertise on over the years. I think it's time for us to really share best practices, share knowledge, and drive global advocacy on major issues that are cost-cutting and we're seeing emerge across the globe. Groups like Amnesty and Human Rights Watch are at the forefront of cross-cutting research, and we should collaborate with local groups or people who have not been able to really focus on this area. I think there's really a need to foster collaboration so various partners can leverage on their strengths and really achieve impact despite the challenges that COVID-19 has presented for the way that human rights defenders and human rights groups do their work. I'll stop here and I'm happy to take any questions or discuss any issues that I might not have been able to touch on because of time. Thank you very much.
Yeah. Thank you very much, Anietie. So I have a couple of questions that I've seen in the chat, very good questions. We have just over 20 minutes to kind of get through them. Otosaki, I think, has proposed a very pertinent question. And I think listening to the rich submissions by our panelists, his question is along the lines of how do we go more than transactional in the sense that international human rights organizations and local and regional organizations are grappling with the now and here and the pragmatic, but how do we go transactional? I think I've had a few of you hint at that, but Anietie and Precious in particular, could you talk to how we can be transformative? How can we imagine a world that is beyond us, even as we grapple with some of the weighty issues? Precious, just in 2 minutes or a minute or two, and then Anietie can
thank you very much. I think that's a very important question, and I think all of the panelists have touched on it in one way or the other. I'll just maybe bring the points together. And it's really the question about being transformative versus being transactional. And I think we're at a time and a moment in history, regardless of COVID, where international human rights organizations cannot help but be accountable to the populations they serve. And like Monica mentioned, it involves principles of inclusion, including all groups, minorities, women, vulnerable groups, sexual minorities. It includes participation, because we are increasingly recognizing more than ever before that people whose rights are threatened are the best to really, provide solutions. They have local capacities which we necessarily do not see, and we need to ensure that we continue to engage them to understand the problems and the situations from their perspective, and to also understand what their local capacities are the use of data, information. Information should be used to drive change. It should help us make decisions. It should help us monitor and evaluate the impact of our work. And above all, in the way in which we as human rights advocates or defenders work, is that we need to follow ethical protocols and standards around code of conduct and how we interact with beneficiaries and affected population. And I think if we are able to put all of these principles into practice, be it with data and research, be it in the way we are inclusive in our programming, be it in the way we engage with affected communities, we'll be moving towards transformation. But also be it in the way we adapt our programming. And someone also raised the question of budgeting and funding, and I'm sure we'll get to it later. Having all these considerations in planning and programming would really help in a long way to putting us on the transformative path.
Anietie, do you have a comment to add onto that? And perhaps getting to the question of how can human rights defenders in Nigeria or other places think about fundraising and resource mobilization to do this work?
Thank you very much. I think the only thing that I will add to what Precious has said is the need, and I think I pointed to this a little bit during my presentation, is really the need for us to not only put the community members and people that we are advocating for, or generally the vulnerable groups that we advocate for, at the front and center of our advocacy efforts, but to really have them take ownership of this issue. Because most of the time, for us, it's conducting research and possibly moving on to the next. It might even be within the same context, but our focus sometimes is really not on. It's hard to sustain our focus onto the point where we're really driving change. So I think for us, and in the way that we're changing, the way that we work, is really to let those who can and will take ownership of the issue and drive it to the end. We're just here to provide support, provide resources, provide expertise in whatever area. But I think putting the people who are at the heart of the issue at the front and center of these issues is really one way to show the human face of the problem, but also to make sure that there's sustained effort in the way that we're working towards achieving change. And I think fundraising is an issue everyone is grappling with. Resources have dwindled because of the economic downturn that COVID has spurred on, and also just because of the anxiety that many people have, not knowing what's to come in the next couple of years. And I think it's been really a difficult conversation that we have to have. I think that we've tried, many people have tried, many organizations have tried to sustain fundraising events or fundraising initiatives by moving to online efforts and really trying to make their work visible online. It's a challenge for groups who traditionally don't work like that, but we've seen that become really, really important, that visibility in this really difficult time, that really shows that your work is important, it's driving change, and should be supported. I also think that finding ways that really connect the issues of our time to the work that we do. Not everyone works on an issue that is easily connected to COVID. But I think that in one way or the other, many of the human rights that we advocate for and defend every day have been impacted by COVID in one way or the other. So I think making these issues more visible and drawing that line is also really important to ensure that the work that you're doing or that we're all doing is sustained and is relevant at this time, so that it is adequately supported. But I don't have the answers to that one. We're also grappling with some of these concerns ourselves, and looking for innovative ways to address them.
Thank you, Anietie. Monica, I'll come back to you to close the loop on this fundraising bit, but let me just shift to Dr. Abebe. There are a lot of very good questions for you here. Richard from Uganda, relates to what you were talking about, Guinea, Botswana, and Algeria. And in light of the elections coming up in February 2021 in Uganda, with the constitutional, issues in that country, he asks, with the constraints towards the elections and the constitutional design there, what do you think? I think Miua talks about the culture in a country, and somebody talks about the doctrine of constitutional necessity, as an exception, towards, speaking about constitutions. Well, what are some of your thoughts on these issues, and what advice would you give to Uganda and other places?
No, thank you very much, George. I think I'll start with Minua's question because it kind of fits into the question from Richard Obedi. Minua is right in saying that the tendency, especially among scholars, legal scholars, is to focus on what is in the text, what is in the Constitution. But it's critical to also, as he rightly points out, to think about the constitutional culture. That is critical. And I think especially in moments of crisis, as we find ourselves in today, you will see that the tendency to see democracy as only about competition, rather than also about cooperation. I think that's where the problem is, because we tend to focus on democracy as competition. We focus on what the government can or cannot do, rather than what could be done together in terms of within a cooperative framework. And that absence of cooperation has meant that there's very little constitutional conventions, practices that are beyond the Constitution, but that are critical, and that are particularly critical in moments like we find ourselves in. And then I think a culture of consultation, a culture of recognizing the opposition, a culture of recognizing civil society organizations, the media as part of the political framework, as legitimate institutions, even if we disagree with them. Essentially recognizing that democracy is not just about competition, but also cooperation is what leads to the development of, if you will, extra constitutional conventions that are as critical, especially when in a moment like this where there's very little, there's not sufficient constitutional guidance. Now, I think, so basically for Minua, we need to develop cooperation as a key factor that can lead to conventions that can help us navigate circumstances like we find today. And this goes to Richard Obedi's question about Ugandan elections. Now, I am not an expert and I don't know everything about Uganda, but what I can say is that whatever decision is taken in the country, it should be, we should not just look at the Constitution, but also make sure that there is political trust, there is engagement with the opposition, so that whatever is done is not seen as advantaging the government. And also about the adjustments, we have to be careful. This understanding, this idea of elections at any cost may actually be detrimental to the opposition. Particularly if you rely, and it also touched on a question that TechnoSpark, it's probably not a name, maybe it's a phone, but it raised about going online. What these changes can lead to is actually strengthen existing inequalities, especially governments have the state structure, the incumbents have the state structure, they have the resources, they have control over the media, over the internet access as well. So if you want to push towards that, we have to be careful because it will actually disadvantage the opposition. So whatever decision we take, we have to be careful, consider the circumstances, but also most importantly, we have to make sure that there is at least a framework, a legal framework that governs it, but also a process to build political trust, a consultative process, perhaps going back to what the Constitutional Court of the Central African Republic has done. In terms of the principle of constitutional necessity, yes, I think for me, almost every constitution today, especially in Africa, has provisions on emergencies. And what emergency provisions do essentially is to domesticate the doctrine of necessity. That's what they do. They are saying whenever it's necessary, we can do certain things that we normally would not be allowed to do. So that it is recognized often, it's domesticated, and as all domestications, there are limits to invoking the principle of necessity, but it is relevant, it is recognized in constitutions, and it is one of the issues, essentially, that's central to the challenge that we face today at a broader level. And you know, it's important that all the measures that we talked about now, all the limitations that we take are taken within the framework of the law. There's a sort of consensus that's built around them, and also that the exception does not become the rule. And I think that's really the danger here. We need to make sure that whatever solutions we produce are indeed temporary, they are transitional. We have to make sure that the temporary does not become permanent. Thank you very much.
Thanks for the clarification and the preciseness, Adem. Monica, maybe just to give you the floor, could you kind of, from a funder or intermediary funder point of view, speak to the point of about, you know, resources? But I will also invite you to take this moment to answer this question, which is that you spoke about the inequalities that are ramped up for marginalized communities, for populations. You talked about women, you know, sexual minorities, and particular categories of people bearing the brunt, a disproportionate brunt in this context. Could you speak, after you speak about the fundraising funding issue to local context, could you speak to this question about to what extent, when talking about women, when talking about sexual minorities, and when talking about vulnerable and marginalized communities, the extent to which this issue, international human rights organizations or broad organizations integrate this issue, and that it is not left to a cohort of select groups? And do you see examples of this issue becoming mainstream? You know, so, you know, other organizations working on women's issues, other organizations working on LGBT and sexual identity and orientation issues as such.
Yeah, thank you. It's a loaded question, and one that I think we've been dealing with. But I want to just go back to all the other questions and just really how do we go more than being, you know, transactional, so to speak. And I think all of us here have talked about collaboration. And I think INGOs find themselves, they are sitting in a very unique position in the sense that they are straddling civil society, and at the same time they have access to government. They have access to spaces that where, you know, normally local NGOs are unable to go. They have access to resources from government, and governments tend to rely on them quite a bit with information about, you know, what to fund and who to contact, who to talk to, etc., etc. And so the collaboration that I think is important, that would transform some of these issues, is around, first of all, I mean, the understanding of where we are today as a continent, and within that continent as diverse communities, diverse countries with diverse vulnerabilities and strengths, and being able to leverage on those strengths and have very honest discussions with government. I think that is an important position that NGOs occupy. And I think we need to be a lot more positional and political and opportunistic in how we present these issues. Particularly, you know, just that funding, you know, it's a resource, it's a power. I mean, we are talking about the South and the North, and the resources are mainly in the North, and they are being sent in dribs and drabs to the South. And at this point, we know that it's not enough, and the strategies are not going to work. And so we have to look at this place that we are at today as an opportunity for change, for transformation, and international NGOs are sitting in a unique place to be able to push for that change and to say, we need to do this differently. We need, the time for panic is gone. We know people are going to die. We know that we are just at the beginning of the pandemic. And so, but we need to be able to build some kind of resilience, right? To build and to position some kind of survivalism in the communities that we live in. And so resilience. And as I said before, and I want to emphasize, is to cement the value of civil society organization, of community participation. And because that's, you know, it kind of does a relationship between the government and the people. It allows that kind of communication for information flow from the government to the people. And civil societies are able to do that. And international civil society have their foot right on the local as well, being able to interact with local communities, get the information. So they are going to be a conduit to those people who hold the power and hold the resources and direct them exactly where they should go. And so for me, I think that is very, 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 very important. First of all, one thing that is important is to ask yourself, what is the cost of exclusion, right? And so if we need to be able, you know, as civil society to tell our governments to say that the cost of exclusion is very high. And so to reduce this is to make sure that inequalities are addressed. The most marginalized people must be prioritized and be put exactly in the middle of the response of this thing, because of course they are being impacted more because they were already suffering systemic and structural inequalities. And so I think for me, I think this is where the collaboration bit, you know, at all levels, even with people that you don't normally collaborate with, you know, just really like community leaders, religious leaders. These are people who hold a lot of sway and influence in our local communities. And it is important during this time because they control quite a lot and they are able to convey and to even build that kind of unity, you know. And so you shift a little bit of that power into the local hands and you see a lot of transformation, some trust being built. You see information flow, resources flowing naturally across from the top to the bottom and the other way around. So for me, I think that's important. The other thing is just about resilience. You know, we are all trying to survive the immediate, and that means we need food on the table, we need shelter, we need medical supplies, we need to feel safe, and so on and so forth. But at the end of the pandemic, what happens? So this is about resilience. How do we survive the pandemic and still be able to thrive after that? And so at this point, I think it is important for all of us in this collaborative initiatives to think longer term. How do we sustain the changes? You know, the aid programming that I think Anietie talked about, and how do we make sure that the resources change? Push our donors to think in a different way, to realize that the SDGs is not just about rhetoric. When we say leave no one behind, what does that mean? Who are the people that we are talking about? Identify those people and have honest discussions. And, you know, I think I've already answered the question that you asked in the end somewhat. The inequalities have always been there. We know that the power relations, whether it's in the family, in society for women, people living with disabilities, LGBTIs, and so on and so forth, those have been there, and that's why a lot of organizations are working on this. So what has happened today is COVID-19, all these lockdowns, the limitations on movement, the insecurities posed by the militarization and police actions are actually taking a toll on women because they work in the informal sector. And that's where they are able to support, their livelihoods, to support the children, to support everyone. And so understanding the root causes of those inequalities. LGBTIs are criminalized and therefore live outside the norm. All of these things. How do we make sure that we address those things so that in the end, we still work on those inequalities even as we provide material support to be able to survive the pandemic. And so I think that is the important thing. And also understanding that every intervention has to respond to the need of the people. And all the 54 countries that we have, or 55 or 56 that we have in Africa, they are very, very different in very unique ways. The communities within them are also very different. They are challenged differently. And understanding those differences, we are able to tailor-make the interventions. And for me, those interventions should come from the people, saying that we have a voice and this is what we need and this is how we can help us. And we have history with pandemics. We have history with crises. And so tap on that history, tap on that knowledge. We have survived before. How did we do it? You will realize community collaboration, community leadership, free information flow, as well as addressing all those structural issues that Adem posed. The issues around rule of law, the issues around corruption, the issues around accountability. Elections, there are many countries coming to elections, Zambia and a few others. How is that going to happen, and how are those going to be accountable? Making sure that happens. The constitutions that we have are not just paper; they are actually being implemented. And so, for me, I think that's just really a comprehensive plan, longer-term plan about resilience and transformation. Thank you.
Thank you very much. So we've come to the end of our webinar. Chiruna is running this final poll, so please kind of just react to it. We are saying, I think I wanted to wrap up with quick things. So we are saying clearly that everything is impacted across the board, from constitutions and the turmoil and crisis that we have in countries, as Adem has kind of given, to every single human rights issue. In trying to deal with that, international human rights organizations must seek this legitimacy in terms of connecting with the people with whom we work, legitimacy in terms of being faithful to addressing those particular needs. At the same time, as we continue doing that, we ought to adapt and evolve. International human rights organizations must adapt and evolve. And in adapting and evolving, that expects us or requires us to draw from lessons on both strategies, the how to do this work, and lessons on how to address inequality, for example, and marginalized, the plight of the marginalized populations and the like, based on past lessons. It has been great to have you. Thank you for attending this COVID-19 discussion forum. I would like to thank our panelists for being very gracious and incisive. I would also want to thank the Center for Human Rights. I would like to thank Tiruna, Yolanda, Tomiwa, and everybody who put this together. And also to remind you that the center is having the next in this series. So next week, the 25th, same time. We hope to see you here, and please spread the word. Thank you very much for attending, and see you again somewhere on these webinars or in person.
Thank you very much, George. Thank you very much, everybody.
Thank you.